Clinical features, we are going to see the diagnostic criteria. So, typically the fever, high spike fever, unresponsive to antipyretics. That is the typical feature of Kawasaki disease. More than 5-day fever. So, fever of at least 5 days, and it can last anywhere up to 3 to 4 weeks without treatment. Apart from fever, the other 5 principal criteria we need to know. In the eyes, look for conjunctival congestion. In the oral cavity, look for changes in the lips, and in the oral cavity, look for any ulcers. Look at the skin for any rash, any exanthems. Look at the extremities, look at the fingers and toes, nail abnormalities, skin peeling, etc. in the extremities. Look at the lymph nodes, non-purulent cervical lymphadenopathy. So, these are the other 5 principal criteria. We will see one by one. So, first picture, look at the conjunctival congestion. Yes, non-exudative, it should not be discharging, no purulent discharge. So, non-exudative conjunctival congestion. Limbus is usually spared. Look at the sparing of the limbus here. Next, look at the oral cavity, a dry cracked lips here, dry cracked lips, erythema of the oral mucosa and strawberry tongue. This is with regards to the second criteria. Third criteria, look at the skin, polymorphous rash, generalized polymorphous rash, maculopapular rash, a scarletiniform like rash. And look at the extremities, edema. You can see here, edema of the hand and feet. It can be indurated also. Look at the extremities here. You can see desquamation in the perineal areas. Look at the fingers, complete desquamation of the fingers. And the 5th criteria will be lymphadenopathy. Look at the cervical lymphadenopathy. It can be unilateral or bilateral, more than 1.5 centimeter and a non-suppurative cervical lymphadenopathy. So, the other clinical features are arthritis, possible, small or large joints, GI involvement, vomiting, abdominal pain, diarrhea, RS involvement, child can have cough or rhinorrhea, and CNS involvement, child can be extremely irritable, typical in KD. Aseptic meningitis can cause irritability. Hepatitis, a gallbladder hydrops can be present. Urethritis will be present, but it is a sterile pyuria. Cardiac involvement, so not just coronary involvement, myocarditis can be present. Disproportionate tachycardia is present in the child. An echo will reveal a decreased ejection fraction. Kawasaki disease children can present with shock also, around 10 to 15% can present like a hypotensive shock. Pericarditis and effusion should be seen in the echo. Mitral regurgitation can be seen rarely. Look for the coronary aneurysms, look for the size of the aneurysms, compare with an Z score. A giant coronary aneurysm is called if the size is more than 8 mm or the Z score is more than 10.